Hello, I'm here with Avis Favaro. And Avis, thank you so much for popping into our makeshift studio.
My pleasure.
And Bante's given us instructions to gather and interview speakers and just ask, what did you think about the symposium and your experience about being a speaker and being at the event?
Well, I mean, I have to say, I was surprised when he asked me to speak. I had met him as part of a news story that we were doing on mental health. And, you know, when he said speak about kindness, I went, that is not really part of my day-to-day job description, but I thought, well, you know, what the heck, let me see what happens. And so I said yes.
Well, that's fabulous. I have a philosophy in my business: say yes and turn up when anything new presents, because it takes you down a path where you meet amazing
Absolutely.
people. You learn new things.
That's right. So you know what it did was it sent me on a bit of a journey of learning about what kindness is in the sense of my work, but also where did it pop up in my life. So I had this thing where I saw synchronicity of kindness, I call it that. Anyway, these little things would pop up where I would go, oh, that's a kindness thing. Oh, that's related to kindness. So I kind of threaded it together into what lessons I had and what it kind of might mean to what this is about.
Because he also promotes mindfulness and mental health, good mental health, and you know he does all these meditations at the temple, and he brings communities, like even the police, together to come and meditate. So he's very active in that way. So I'm going to ask you a question. I haven't asked any of the other speakers here, but with your background and being a medical correspondent, do you think that kindfulness is something that gets made up in the mind or in the heart, or both maybe?
Well, I can really only go by what I learned. And so I was in San Diego working on a story for an upcoming show. And the public relations person told me about $100 million gift to the university to study kindness and empathy in the brain. $100 million from a philanthropist who, with the researcher, had been given basically the mission by the Dalai Lama: go find kindness in the brain, go find it. Where is it in the brain? Measure it. And then if we train people to become more kind, what happens to their brain and what happens to the patient's brain? So this is being done in the context of the medical world. So if you can make a doctor be more kind, mindful to the patient and how they're doing, how does their brain change? How does the patient's brain change? So I think science, this is an area for science. We know that kindness, when I reviewed the studies that are out, that when people do kind things, they feel better. So that's a mood lift. And they've seen bits of altruism and light up in the brain in certain areas. But this is going to be the first measurable discussion of where is kindness, what does it look like, when you see it, can you train it to light up more, and then what happens to the patient. So fascinating.
It is absolutely amazing. I want to thank you so much for sharing that information with us, and that takes care of the next question. Is this a worthy cause to be involved in? Of course. I mean, this is just amazing.
I can't wait to get the results because, you know, if they can figure that out, they can train doctors, they can train nurses, enhance the whatever kindness is in our brain if they can find it, and then move on to law schools, elementary schools, high schools. So that might be able to find a way to make everything.
Can you imagine taking it into institutions that are now almost hopeless? Psychiatric wards and institutions for for mentally insane. Can you imagine taking that research and changing people at that level? It would be amazing.
And then the question is, if you move it earlier into the elementary. And school system, can you make people kinder from the get-go or enhance whatever part of the brain? Maybe not, but scientists have the money now to go look at it, and so they're going to use brain scans and EEGs to see what's happening. We may have some early answers in as early as 2 years.
Oh, 2 years? That's pretty fast. Wow.
$100 million goes a long way.
It does, yeah.
Yeah.
Wow. Well, whoever that philanthropist is, we're really grateful, because this is, wow. And you know, on a planet where where money is spent on defense and politics and playing games and warfare and guns and,
That's right.
you know, to actually have money directed to a study that could actually change humanity. I mean, that
Well,
is,
the important thing is that science needs evidence.
yeah.
And so we know we have the brain scans. We know that we have training programs that help make medical professionals more empathetic, but actually physically seeing where the signals are, because they can see where the brain is more lit up in one thing. Having that kind of irrefutable evidence that you can go back at and look at again, that's really important, because I think most people don't think of kindness. They certainly don't think it's anything that you can do anything with in terms of promoting or enhancing it. So having that will be very important to see if the concept of kindness in medicine will fly. You need proof.
Yeah. Well, I mean, it's only a few years ago that the placebo effect wasn't even discussed. You know, people didn't even talk about the fact that if you took medicine that didn't have any medicinal value in
That's
it,
right.
people still healed. So I think this is an important study.
And maybe kindness has something to do with it. I don't know. You know, maybe how people
kindness as a placebo, that's interesting.
Well, they do know that when people feel that their physicians or the nurses are compassionate towards them, they do better.
Yes.
They're more adherent to their medications. They're more verbal with what their symptoms are. So they do better. So this could be a win-win with the healthcare system, because how many patients go to their physician or go to hospital and they feel totally neglected, or they feel like a number or an aggregate of cells and organs. You know, they don't feel like
they're not being heard and felt.
They're not being heard. So it's an attempt to shift, and that's where philanthropy comes in. Because where else would you get $100 million to study this? It's amazing. It's a wonderful thing.
My goodness me, isn't this amazing? I want to thank you so much for coming to share this.
Thank you.
And if you want to give Bante a message and just tell him and encourage him to carry on with the symposium,
well, I think
that'd
thank you for inviting me. It's been a personal journey, and I've learned a lot about kindness, and I've learned about how it fits into many of the stories that I do. So I think I'm more aware of it now.
Fabulous. Thank you. Thank you so much.